I would be attacked by this silent killer. So when I was 65, I had a very trivial fall and my hip bone broke. And Alhamdulillah, I came immediately to Ibrahim Haji Hospital and I was taken good care of it. Dr. Shabir was all throughout with me, and I must say I was in good hands.
Salamun alaikum. Today my colleague Dr. Rafia and myself are here to present a few lines on a very important topic. In life, we go through a cycle. When we are born, and the pediatrician will tell you more, we are fully dependent. We can't even walk, we can't eat ourselves, we can't talk until we're taught how to. And then we reach a stage in life in which we're able to do things, we have the strength, we have the power. And then as we age, as our community is aging, something that there is a misbalance between our bone and bone density and bone strength. There's a mismatch between the bone cells that grow the bones and the bone cells that break the bones. And there we get a silent killer, which is known as osteoporosis. Dr. Rafia, what do you know about osteoporosis on a more personal level?
Yes, as you just mentioned, that it is a silent killer. It creeps and crawls into your body without any warning, and the symptoms are not, one is not aware of the symptoms. And it did come to me as a shocking surprise. I had done my DEXA scan. DEXA scan is the gold standard for diagnosis of osteoporosis. So at the age of 50, I had done my DEXA scan and I was very happy when it was reported to be normal. The vitamin D levels were normal. And then being a gym addict all throughout my life, I never thought I would be attacked by this silent killer. So when I was 65, I had a very trivial fall and my hip bone broke. And Alhamdulillah, I came immediately to Ibrahim Haji Hospital and I was taken good care of it. Dr. Shabir was all throughout with me, and I must say I was in good hands, number one. But yes, it did come as a shocking surprise to me. And number two, the procedure went very smoothly, and post-operatively, the physiotherapy, the physical therapist guy here also was very friendly and very cooperative. And recovery was, I must say, very smooth and flawless. And for that, I shall always remain indebted to Dr. Shabir and to Ibrahim Haji. And at this point, I think I won't be wrong if I mention a lot of my friends at that time would call me and tell me, oh, why did you get it done here? And why didn't you go to other hospital or wherever? But I believe that the healer is the same wherever you go. And it depends how you positively look at where you are.
So, doctor, you mentioned with regards to being asymptomatic, so it having no symptoms. So, one of the things about our bone density is the signs are not shown. So, you don't get pain very frequently. It comes as a surprise. So, one of the things that we should know is what are the risk factors and what are things that can prevent osteoporosis. So, the risk factors is number one, age.
Sure.
Age cannot be modified. You cannot control age. So, one of the recommendations by the World Health Organization is once you cross the age of 55 for women and 60 for male, then it is recommended every 3 to 4 years you should get a DEXA scan. But more importantly is see your specialist who will take a history, which will also show a family history. If there is anybody else who is suffering from osteoporosis, then your risk factor is also high. The other risk factor is having a sedentary lifestyle. So office job, white collar job, these are all risk factors for having osteoporosis. The other aspect is diet. So a diet lacking calcium and vitamin D is also a risk factor of having low bone mass and low bone density. Hence, the risk of fractures is very high. So it is essential that we do exercise at least 2.5 to 3 hours, and these are divided into three factors. One is the bone strengthening or weight bearing exercises, that is walking, jogging, and things like that. The other are muscle strengthening exercises. So some minor weightlifting, whether it's 1 kilo or 2 kilo or even 5 kilo, if you can, at a moderated pace, that increases the density of the bone, but also flexibility. So things like yoga and things like that, they improve the flexibility, but also stability and the posture. So these are very important things. Yeah. So
Of
Dr.
course,
Rafia,
yes.
yeah,
I think my smooth recovery was because I listened to you in all that, and I did all that, and I'm still continuing to do all through the days. 2 to 3 hours I'm at the gym.
so it's very important also to have a balanced diet. So high calcium foods include but not limited to dairy products such as milk and yogurt. Our body needs at least 700 milligram of calcium daily. Of course, those who are above 55 and 60, they need extra supplements even if they can take orally. Something else which has high calcium is almonds or some kinds of fish like sardines. On the other hand, high vitamin D food and diet include egg yolks and fish as well. And leafy greens have a lot of calcium as well. So like spinach, they have a lot of calcium D. So basically it's all about balancing a healthy lifestyle, exercise, diet and nutrition, taking care of your health, and of course, timely checkups. What else do you think, Dr. Rafia?
What about exposure to the sun?
Exposure to the sun is extremely important because it is essential for the converting the inactive vitamin D that the body cannot use to active vitamin D, and that is only done through sunlight.
In our books for children, like we always advise the parents to expose 25% of the body for 20 minutes to get the required amount of vitamin D per day. And also, the half-life of vitamin D is about 2 to 3 weeks in the body. And many a times people, they will eat vitamin D, wait for some time, and then go to do the test, and they will see that, oh, the vitamin D is low and I've been taking the supplements, but it's important to know that the half-life is only 2 to 3 weeks. So that's another point to be noted.
Yeah, so a lot of us sometimes are hesitant to go for medical checkups because we know, okay, something or the other will be found out and I won't be having treatment for that. But for osteoporosis, the good news is there are oral medicines, there are lifestyle changes as we discussed, but there are also parenteral, so injections, which can also be given once in a year, whose effects are very nice, and they are extremely important in preventing fractures. It's all about preventing fractures. As the old saying goes, prevention is better than cure. And there are modern therapies that are very effective in terms of prevention of the fractures and treating the overall disease of osteoporosis.
Yeah, sure. This once a year injection, I think, is the best thing that has happened for osteoporosis.
So eat well, exercise, check your health so that we prevent fractures rather than treating them. Assalamu alaikum wa rahmatullahi wa barakatuh.